Our project is a USAID funded project. It's a global one. We're in 14 countries. It's led by a team of a consortium led by Health Associates, which I work for. The focus or the aim is to strengthen the health system. And strengthening the health system, we are looking at two important building blocks of health system. I'm sure all of us, or almost all of us, we are aware of what the building blocks of health systems are. And when somebody asks me, the simple way I describe it is that if anybody goes to the hospital, the 6th building block, you go there to access service, whether preventive or curative service. That is one. 2, somebody has to provide that service. That is the human being, human resource for health. That human being will use drug or vaccine or equipment. That's the third component. The fourth component is that somebody has to pay for it. No free lunch. Even the free service, somebody is paying for it. And number 4 is that there is supposed to be governance, policy, and regulations that guide the provision of services. That is number 5. And number 6 is that we need information around all those 5 that I've mentioned. That is health management information system. Those are the important building blocks. But out of these building blocks, 2 are extremely important. And that is money and governance. And that is why our project is asked to look at health, finance, and governance. And area of health finance, there are 2 important slogans in health financing. One is more money for health. The other one is more health for the money. What does this mean? When we say more money for health, of course we need to mobilize additional resources to get health workers, to get drugs, to get infrastructure and many other things. But as we see later, and as our senior colleague in the profession told us, that is not enough. We need to achieve more health for the money itself. We'll see in the graph short while. Then in terms of governance, how do we manage these resources? There is something we call governance instruments, which include policy, management system, the institutional capacity, intersectoral and intersectoral coordination and collaboration, and then the accountability mechanism. Those are the things we call governance. We may not bother about all those details for now. So we focus on these 2 areas, and later on we'll see how this thing relates to a resource mobilization in HIV/AIDS. So next slide. I hope all of us can see these charts. Hello? I need a volunteer to quickly tell me the observation. And let me give you the background. This chart, each dot you see there represents a country. I will plot a chart of a country looking at their under 5 mortality rates and the total health expenditure per capita, meaning amount of money that is spent on health in that country. We plot that chart to look at how are they faring in terms of health outcome under 5 mortality rates. So each dot represents a country. Somebody, a volunteer quickly to raise up his hand or her hand to tell me the observation. Any observation? No observation? This chart. Okay, thank you, sir.
On his healthcare system, the lower the under 5 mortality, and the lesser they spend, the more the under 5 mortality. And countries that spend less on healthcare systems are more in number.
Thank you very much. In other words, the more we spend, the better the health outcome. So more money is needed. And if you look at these charts, virtually no country was able to reduce child mortality rates below 40 per 1,000 live births when they spend maybe less than $200 per person per year. So money is very important. The volume of the money is very important. Next slide. Again, if you look at the low spenders, those people that are spending less than $100 per person per year, what can you observe? Another observation. What can you observe? Yeah, I think it's very pretty straightforward. But what can you observe? A young lady this time around. No observation from women?
Maybe an old
among people that are countries that are spending less than 100, what can you observe in terms of their ability to reduce under 5 mortality rate? Any observation? Maybe I'll cross the gender line now. Men again?
the older ladies.
Eh?
You say young lady now.
Oh, it's because I said young lady.
Yes.
Okay, thank you very much.
Good afternoon. Well, from what I am seeing, the country that spend less on health, you find out that the mortality rates will be very high than the country that spend more.
Okay, I think, thank you. That was actually, I think, right, but that is not the focus of these discussions now. If you look at people that spend, countries that spend below $100 per person, there are some of them that are able to keep under 5 mortality rate low. And there are some of them that even with the same amount of money, they are not able to achieve better results. Is this clear? Because this is very fundamental. In other words, 2 countries spend the same amount of money, but they achieve different results. Mr. John gives Madam 10,000 to go to the market. Mr. Emeka gives his Madam the same 10,000, but the woman came back with different. One came with the polythene bag of materials, then one actually needed to charter a vehicle to bring the materials back home with the same amount of money. What we are trying to say is that in as much as more money is needed for health, it is important to achieve more health outcome for the same amount of money. That is where the issue of efficiency comes in. And as we move towards generating additional resources, we are going to be looking at 2 things: more money for health and more health for the money, which is very, very important. Now, let me quickly tell you what we do in Nigeria, then we'll go to resource mobilization proper. Let's like I said, we focus on the local needs, and in Nigeria we have MNCH stream of work. Not good there, we have TB stream of work. In the area of HIV, our main focus is to support the stakeholder to stimulate additional domestic financing for HIV/AIDS response. So that is what we'll be doing going forward. Next slide. Now, how do we do this? This describes the overall framework of what we do as we try as much as possible to stimulate domestic financing. Number 1, before we spend more money, before government spend more money on health, the government wants to know how much exactly do you want me to spend. When you approach Mr. Governor, he wants to know how much do you need to achieve so thing. That is resource planning. Under that, it's not enough to tell Mr. Governor that HIV/AIDS, we need 250 million every year for the next 3 years. Mr. Governor is interested, what is the money going to buy? And all of us, whenever we spend money, we are buying something, is that not? So what would the money going to buy in terms of improved HIV/AIDS outcome? How many people are we placing on treatment? How many deaths are we preventing? But again, another analysis which is very, very important. You know, most of us in the health sector, we like talking to ourselves. We like speaking the language that it is only us that understand it, without considering people that are at the receiving end. If you are talking to them in the Ministry of Finance, the language they understand most is the language, economic language. The money we are spending on HIV/AIDS, how does it affect the gross domestic product of Rivers State? Now we are talking. So we need to do this analysis so that the spending becomes more attractive to the government. That if I put the money, because we often forget that government has a lot of priorities. Education is there, water is there, many other things, security and all those stuff. So we have to give a multi-dimensional case, or cases as the case may be, for HIV/AIDS investments, which include financial, political, epidemiological, and social cases that will attract the interest of this political class. Next is that if we are certain about the amount of money we need, that is why it is very important, that is why we work with FHI CEDAS, who is supporting the government in the area of prevention, treatment, and care, to together sit down and do this sustainability plan, which will form the basis for resource mobilization, which will form the basis for talking to the government that this is the amount of money we need. Then we'll go to the resource mobilization, which we are doing now, which is about using established mechanism to mobilize the resources from available sources to achieve what we intend to achieve. The next thing is to allocate those resources. Hello, are we together? If we have mobilized the resources, we will sit down with the relevant agencies, SASCA, line ministries, who is going to put what in the budget. Remember, what is not budgeted for will not be spent by government. It is by law. What is not budgeted for ordinarily will not be spent. So we'll allocate. The next that you can see there, you know they are interwoven there, is the resource tracking, to find out that from the beginning to the source, the money actually gets to the end point and it is used for what it's meant for. And again, in the area of utilization, we're interested in who is benefiting across the social divides, male, female, rural, urban, poor, rich, so that the concept of equity is well adhered to. Next slide. Now, later on in the afternoon, we'll be looking at how resource mobilization is done, but consistent with the national strategic framework on HIV/AIDS resource mobilization. There are 4 important pillars, and the number 1 is to look at how do we increase government resources. Partners are supporting us. Can government to do more? How do we make the government to do more? Again, looking at the private sector, how do we mobilize additional resources from private sector? Then the issue of efficiency, even the little that is available from donor, from government, from private sector, how do we improve the efficiency? Then 4, we look at the issue of governance. Maybe a few things on each of these pillars before we move on. In the area of increasing government resources, part of what we've done is to do what we call situation analysis. How much is government budgeting and how much government is spending? And how do we increase the allocation and releases as well? But remember, we might not be able to do this until we have full understanding of the public financial management processes. How are the budgets prepared? From one ministry to the other, what are the responsibilities and what could go wrong in between? And how do we take advantage of this knowledge to improve the budgeting for HIV/AIDS and health as a whole? Then it's not enough. Most of us know that allocation is usually not the problem, but the release of the money. Again, it might be difficult to stimulate increase in the releases for HIV and health if you don't understand the processes. Somebody once told me that if you have overhead tank in your flat and the tap is not running in your bedroom, If we invite a plumber, what plumber needs to understand first is the plumbing network in your house to identify where the blockage is so that they will go and remove it. So if money is budgeted, that is the money in the overhead tank now, it is there, and it's not getting to the end point, where could the problem be? The pipeline. Where is the pipeline blocked? You understand? It's very important for us to understand all those processes and to understand the political landscape as well. There's something they call interest influence mapping. Who are those people that are interested and that are influenced? They are influential in this cause. Those are the people we need to target. When we do advocacy, that is what they call targeted advocacy, not just to anybody. Not just to somebody that will just knock, yes, we are interested. They might be interested but not influential, I cannot influence anything. So we'll do process mapping, we'll do political landscape to know if you want more money, and at the same time to understand the overall economic situation of the state. A state where it is difficult to pay salary, it might be also difficult to raise money for anything. You understand? Again, the same thing applies to the private sector. Who are those people in the private sector? What is their